Our main focus is treatment of the foreigners who are coming to our Krakow city, not only for the dental treatment, but due also to the excellent possibility to have the holiday here. Krakow is a former capital of Poland with a lot of the tourist attraction, monuments and stuff like that. So our patients love not only to come to Krakow just for the dental treatment, but also to combine it with the holidays. Krakow also, this is very important, it's the second biggest airport in Poland with over 3 million passengers per year. So it's very important that our patient has got excellent, direct, cheap flight connections from all European countries to our city. What is also very important to mention is the facilities we've got in Krakow. We've got excellent possibility to find a very nice hotel and also apartments. Moreover, for our patients, we are able to provide our own apartments just opposite the street. And our customer service center is responsible for helping the patients to find the best flight connections and also to arrange the pickup from the airport with our English-speaking driver. So our main field of interest is medical tourism. We do all our best to deliver to the patient the top quality service, the dental service, for the best price that they are not able to find at home. We are of course also focusing on a customer service, and this is what differs our clinic from anything else, because the patient who contact with us mainly on email or through one of our tour operators in whole Europe, they always get the information before they will come. It means they will know more or less what to expect, what is the price of the treatment, what is the length of the treatment. We are also able to arrange for the patients the accommodation, all to find and to help them how to spend the free time in Krakow. Per year, we get around 30 to 50 foreigners per month, and this is around 70 to 80% of all our patients. And we are doing that for over 10 years. That clinic is our brand new investment, which was just opened 1 year ago. And we put a lot of efforts to create here a warm, friendly atmosphere at the reception desk, so the patients will not feel like in a real dental office waiting for the verdict of life or death. So we are also putting a lot of efforts on direct communication with the patient. We've got our staff, a native speaker staff from UK, from Sweden, from Norway, who are responsible and who are attending to our patients before, during and after the treatment. So just to give you an example, when the patient has got some technical questions about the logistic of the treatment or would like somebody to advise him where is a good restaurant or a nice nightclub or where to go afterwards or what is worth to visit, our customer service center is more than happy to help him. Also, what is very important is the safety of our patients. I'm not talking about the medical procedures right now, but I'm talking about spending the free time in Krakow, because all our patients are, we are providing to them the mobile telephones with the Polish SIM card, so they are all the time with the contact with our customer service. And of course, we've got 24 hours helpline in English and Norwegian language in case of any problems or any questions. We are ready to help our patients. Now, about the medical stuff, this is a new clinic. We've got 7 operation rooms, including the fully equipped surgery room. It's a 300 square meters here, and 11 second-degree top-quality specialists are working here. We are covering absolutely all discipline of dentistry beside orthodontics. The reason for that is that it's not worth for foreigners to travel each month to Krakow for some small adjustments. So beside orthodontics, we are covering absolutely everything. And average patient, what kind of procedures we are able to do? Nobody will come to Krakow just to fix one tooth. It's not a good idea, unless it's just combined with the holiday. But most of our patients are coming here. We called it something like extreme makeovers or smile changers, because we are able to provide them the top quality service in an extremely limited time. Now, I'd like to tell you one extremely interesting thing, at least from my point of view, because when we started that business like 10 years ago, most of our patients were coming to our office due to the price difference. Just one short example, endodontic treatment in UK, re-endo or retreatment, starting from 600, 700 British pounds at least. the top quality endodontic treatment at our office with the microscopes, with the computers, you are able to get for less than 300. And this is just one example. So when we started that business a long time ago, the main issue was the price difference. But now, from like 2-3 years, what we found that not only the price is important for the patient, more important is the time issue. We've got a lot of the active patients, I mean active in the meaning they are working and they are busy and they cannot afford to spend a lot of time waiting for the treatment or waiting for a couple of visits. So what we are able to provide to our patients is extremely intensive, top quality and pain-free treatment. This is our main focus. Usually, the patient is coming just for 5 working days. They are arriving on Sunday, leaving on Saturday, and during the 5 work days, we are able to do most of the procedures that are necessary. Now, before we start any kind of the treatment, the patient, of course, is making the control x-rays. We've got the fully equipped digital x-ray office here, including CBCT. CBCT is a cone beam computer tomography, a 3-dimensional scanning system. So we are able in 40 seconds to scan the whole skull of the patient to give him the precise and exact information about the bone quality, and we are able to plan in 3D, in 3 dimensions. We are able to plan the treatment. Moreover, we are able to show to the patient how he will be looking like after the treatment. So then the patient is going to meet the dentist, and we are working as a team. There is 11 dentists working here, and in Poland, this is a unique comparing to the Western European countries. We've got a different type of education. We are not only we are not only specializing in dentistry. We've got more general medical knowledge, but in dentistry, this is very important. We split our field of view. It means that you don't find any more general dentists here. We've got specialists, very narrow specialists. Just to give example, my specialty is endodentistry, and I'm doing only endodentistry and nothing else. So we've got narrow specialties. So we've got something what we call a brainstorm over the case. 2, 3, 4 specialists are meeting together and explaining to the patient what are the options of the treatment. And this is very, very important, because before you will make any decision what kind of the treatment you want to have, you will get absolutely all information about the options, about advantages, disadvantages, possible implications of that. Moreover, you get everything on paper in English or Norwegian language. With the stages of the treatment, you always know what will be the cost of the treatment with no hidden costs. You will know what is the length of the treatment which is necessary to perform that, and you will know what is the necessary breaking time or the waiting time between the stages of the treatment. So we provide all of that information to the patient, and we are using also a 3-dimension models, and we are using a real cast alloys or real crowns to explain to the patient what are the differences between the different types of the work. Besides we call it extreme makeovers, I mean implant treatment, bone grafting, bone transplantation, or severe prosthetic work and very serious endodentistry, we are also focusing on children. We've got a specially equipped dental office with the equipment which is designed for children. And I'm talking now also about the procedures as a pain-free and stress-free dentistry, because we are doing a lot of the conscious sedation or nitrous oxide sedation. And also we've got a special equipment which is designed for pain-free dentistry among the children, like the ozone device. We are able to treat the holes or the cavities with no drilling procedures. This is very important. Moreover, especially with children, we are focusing on pain-free. It means that we are using on a routine base the computer control systems. And we've got the newest one, it's called STA, single tooth anesthesia from the WAND company, from Milestone company. And that device allows us to perform the local anesthetic injection absolutely pain-free. So the child even doesn't know when the injection will be delivered. What is most funny thing that our adult patients are also more than happy to use those methods of pain and stress control, especially with more severe procedures like bone grafting or bone surgery procedures. We are able to do the long procedures like just example, bilateral open sinus lift with the bone grafting and bone augmentation will take around 4 hours, 4.5 hours. And then due to the comfort of the patient, stress-free and pain-free dentistry, we advise to the patient that if only the patient would like to go for that, we can do it under conscious sedation. What is the conscious sedation? It's not a general anesthesia. It's very important to understand the difference because you're not sleeping during the procedure. You're still conscious, or actually semi-conscious, but you don't feel fear, you don't feel pain, and what is the most important, you don't remember anything. So this is very nice and very well tolerated by our patient, and they are very happy to go for that.